That's kitten 5. Yes. Yeah. A little bit on you were going somewhere, huh?
He's like, where'd my friend?
We're suckers for kittens with a sad story for sure. These guys are, luckily most of them are in okay shape, and we just feel like they need a little bit of extra love.
What are your biggest concerns with burned?
There are 2 of them that have suffered burns to more parts of their bodies. One in particular, his whole belly is burned, and when you have that much coverage of burn, it causes a lot of systemic issues, and he's very, very dehydrated today. So our main concerns with anything that's experienced smoke or fire, obviously traumatic burns themselves, then we look for smoke inhalation issues, so if there's changes in the chest. Dehydration is a huge one. These guys can get nasty secondary infections. And then they also develop sort of a systemic response to pain and trauma that can actually just shut down all of their organs. So that's obviously worst case scenario, but that's the ones who start to not eat. They are really lethargic. And one of the ones we have today is starting to head in that direction, and so that's why we saw them for a recheck. All 5 of them are getting what we call Subc fluids, so just a little bit of fluid under the skin that helps with their hydration. And then the one who's in really rough shape is going to go on IV fluids, pain control, antibiotics, kind of everything we can give him. We would guess, just based on how they look, they're somewhere probably between 8 and 12 weeks. The smallest of them is about half the size of the others. The 3 of them who are doing really well, long term there shouldn't be any issues at all. They may have some scarring on their little paw pads, but that's about it. The 2 orange ones, the really, really small guy, unfortunately does have a guarded prognosis at this time, but we'll do our best.